Hi folks, this is Siegfried with Loveland Medical Clinic. I thought I would shoot a quick video on vitamin C and why it's one of the 4 major supplements that I take pretty much on a daily basis. So there's research going back about 80 years regarding the use of vitamin C. Linus Pauling, who won not one but 2 Nobel Prizes, was a huge advocate for large dosages of vitamin C. And in the 1940s, there was a doctor, I think his name was Dr. KLENNER, who cured 60 out of 60 cases of polio using high doses of vitamin C. The science is, the hospitals are finally catching up, and now some hospitals are actually using IV vitamin C on their septic patients. Basically, vitamin C is a massively good antioxidant, and you should be taking it daily. Now, I don't know if you know this or not, but humans, guinea pigs, and monkeys, we can't make our own vitamin C. Every other animal in the animal kingdom, well, fishes don't count, but make vitamin C, and it's necessary. It's how we get rid of toxins, how we get rid of oxidants. Most inflammation and chronic diseases are basically an oxidative process, and so vitamin C can change that and take care of that process. Okay, recommended daily allowance by the government, they say you only need 40 milligrams of as an infant of vitamin C per day, up to about 90 milligrams of vitamin C per day as an adult. Now that's a joke, folks. Animals pretty much make about 30 milligrams per kilogram. So for a 70 kilogram human being, that would mean you should be taking 2,100 milligrams of vitamin C a day. And that's just, that's what you should be taking. I personally take about 2 grams per day, and if I'm feeling a little sick, I'll go up to 5 grams per day. Okay? Some people think that orally you cannot, after a certain amount, like I think it's 1,000 milligrams, your body can't absorb anymore, and that's not quite right. The easiest way actually to do this is to take a dose, say 1,000 milligrams, and then 2 hours later take another dose, 1,000 milligrams, and you can keep on doing that. Okay, and your body will continue to increase the level of vitamin C. The problem is taking oral vitamin C is that eventually you're going to hit a point where you get what we call the vitamin C flush, and yes, you are flushing your body and you'll be sitting on the toilet. So that's why if you want to really take high doses of vitamin C, the IV method is actually the way to go. Okay, there's a clinic in Kansas called a Riordan Clinic, and they use high-dose vitamin C for cancer. Okay, and they've been doing this for years, and they've actually published more research on this particular topic than anyone else in the world. Basically, what happens is that vitamin C can cause production of hydrogen peroxide, which is poison to cancer cells, and your normal body cells can actually handle that, so that it's not a problem for your normal cells. So basically it's a toxin to cancer cells, and it's helping your cells stay healthy. Okay, the way chemotherapy works though is it kills all cells. Okay, so that's why vitamin C is so much nicer than having chemotherapy. Now if you're going to be using both chemotherapy and IV vitamin C, you got to stagger them. Okay, because actually the vitamin C will cancel out the chemotherapy. So if you're going to do chemotherapy on one day, do the IV vitamin C on another day, and just stagger the dosages. Okay, and this always should be done in conjunction with your oncologist. Okay. Radiation also kills cancer by causing oxidative stress in the cancer cells. So once again, if you're going to do radiation therapy and vitamin C infusions, make sure that you stagger the days that you're actually doing these things on. Okay. I have more details on a blog post I wrote, so if you go below this video and click on the link, there's a whole bunch of links and research papers and all that kind of stuff that you can go to and see what I'm talking about. So, are there side effects from taking high-dose vitamin C? Well, if you have something called hemachromatosis, which is basically an accumulation of iron in the liver, you should not be taking vitamin C. Also, if you have something called G6PD deficiency, it's an enzyme, you should not be taking high-dose vitamin C. And people that tend to have the G6PD deficiency tend to be from African descent or from Mediterranean descent. Okay, so you should it's a really easy test to see if you have this missing enzyme, and you should get this test done if you are actually going to be going to have high-dose vitamin C. This is Siegfried with the Loveland Medical Clinic, and this is my quick little spiel on vitamin C, and I hope you enjoyed it. Thanks.